Hello and welcome to the HIPAA Insider Show. We often talk about securing data from hackers, but what about the patient data that is being legally sold right out from under us? Today, we're talking to a healthcare heavy hitter who's going to be shining a light on the multi-billion-dollar healthcare data broker industry and how we can opt out. Stay tuned. Welcome back to the HIPAA Insider Show. I'm your host, Adam Z. And before we get started, if the conversations we've been having related to healthcare, cloud, and data privacy have been useful to you, please hit the like button and be sure to subscribe so that we can bring more content and guests to you. So today we have a very special guest on the podcast, very special guest, who's building the future of patient privacy. Please welcome Dr. Edward Sharpless, co-founder of HealthConsent. Hey,
Hello,
Edward,
how are you? I'm great. How are you?
Doing very well. Thank you. For a happy Friday.
To you as well. Hopefully people stay warm and it's not too wet.
Yeah. It's been quite the hectic week for me, but I'm slowly but surely closing down some tabs and getting into that Friday feeling. How's your week been going?
Busy. We've been grinding this week. We have a big new feature coming out this weekend, and so there's just been a lot of work happening from the development side.
Fantastic. Yeah. Okay, well, let's dive into it then. So HealthConsent. To kick things off, could you share a little bit about your professional background and then the journey that led you to HealthConsent?
Sure. Well, I have been building startups for a few decades, and right now I run a venture studio focused primarily on building healthcare startups, and I've been doing this for about 13 years now, focused specifically on healthcare startups. Earlier in my career, I founded and exited two companies, one in tech and one in healthcare technology. And after that, I decided to start helping large kind of multi-billion-dollar healthcare organizations innovate by building spin-off companies or launching new business lines. And so that's what work I've primarily been doing over the last 13 or so years. And over the last few years, our team decided that we wanted to start building some of our own startups and our own solutions. As we learned a lot of things by being deep in the industry over the years, we thought we would want to bring a few of our own solutions to bear, and HealthConsent is the first one.
Oh, fantastic. Yeah, and I checked out Sharpless as well, and I love it when a founder puts their name on the tin, because it just shows that they mean business. So that's great. So many people kind of assume that with HIPAA regulations completely prevent the sharing of medical information, but it sounds like that's not quite the case. Can you explain the reality versus what we expect?
Well, I think from a patient perspective, believing that HIPAA prevents the sharing of their medical information is a bit of a myth. HIPAA enables the sharing of their medical information freely. It's really kind of a data sharing framework disguised as a privacy firewall. And data can be passed freely under the guise of treatment, payment, and healthcare operations. And this was a law written by big healthcare, by the EMR companies, by the data brokers, essentially to benefit themselves. The best way I like to describe it is if you're writing a law kind of or building a security system to protect your home, and you've got your back door protected and you've got your basement windows protected. Meanwhile, your front door is wide open and your stuff is walking out. That's kind of how I would liken how HIPAA was written in terms of people's personal medical information. And so, we punish organizations for having a breach of their data within their own kind of ecosystems. And yet that same data is flowing freely down through the food chain, ultimately to big multi-billion-dollar data brokers who are selling it for a profit. So the data broker industry, is 300 billion overall, and the health data broker industry is about 10 billion right now.
There's there's a de-identification process, I think, right? When it comes to like if there's some data, they scrub the first names and the phone numbers off it before they process it, and that's how the data brokers are able to purchase and sell that information. That's at least that's how I understood it.
Yeah, so built into HIPAA is de-identification. There's some kind of strict rules about the data points that need to be de-identified. But de-identified doesn't mean anonymous. It means, legally sanitized. And the problem is with only a few data points, data can be re-identified. And there's been a number of published studies that show this. One study showed that zip code, full date of birth, and sex can uniquely identify 87% of Americans.
Wow.
There's other studies that show you don't even need the actual birth date. You just need a range and some behavioral attributes, and you can identify the majority of people in that data set. So that's the issue, right? It's not really de-identified. And, when they wrote the law, I don't think we were as advanced maybe in our data processing and our technological innovation. So, we'll give them that grace, but the legal system, and I think we can talk about this later, hasn't really caught up with the realities of modern day technology. So, de-identification now really is paired with what they call tokenization. And so you have companies out there that have these things called tokens, which they essentially assign to each individual. And so they can get disparate data sets, not only in healthcare, but they can get consumer data sets that have your location data, your behavior data, your purchasing data, your social media activities, everything. And using that token, they can connect your private health information to everything else about you and have a complete picture of your life. And that's what they're doing. And they're actively marketing this. It's kind of a known secret in the industry. They're actively selling this to the tune of billions of dollars, and most people don't know what's happening.
So if I'm understanding this correctly, there's the identification of the data that's done and then the data brokers have that data. Is that the tokenized data, or does that come later down the line?
No, so the path of it is really, if you think about the path of data, you visit the doctor's office. The doctor sees you, the doctor puts their notes into an EMR, and then EMRs typically send or process claims initially, right? They're sending those to a clearinghouse, which is the next middleman that most people don't know about. That clearinghouse is then, kind of cleansing those in the claims and then sending them off to the various payers. The payers are then, paying the claims, but that data then ends up in the hands of data brokers. And so there's this food chain when you visit the doctor or the pharmacy, the same thing, pharmacy, PBM, clearinghouse, payer, data broker, same with the labs. And so they're collecting this massive amount of data, healthcare data on people. And so after they have that data, right, it's when it gets to the data broker, it is de-identified, right, legally in order to get to a data broker, because technically they're not a business associate or they're not covered by, TPO, which is, treatment plan or healthcare operations. But that de-identified data can be re-identified using these things, using tokens essentially to link these other data sets.
Wow. Yeah, no, that makes a lot more sense now, and it's quite startling when you flesh it out and explain how the data flows. So then what, you don't have to name any names, but like I assume there was a tipping point, and you came to these conclusions through your experience and your professional endeavors. So what was that tipping point, and when did you realize you have to do something and create a new platform to address the privacy gaps?
Sure, a great question. So we were working on a client project, and we were looking at acquiring a very large data set, millions and millions of rows of patient data. And what do you do when you need data? You start to talk to the data brokers. And so we started those conversations. As we were designing the type of data that we needed, we realized we needed both EMR data, which would be ambulatory, as well as kind of hospital data, and then outcomes data if we could get it. because we were building kind of a fairly complex AI system that needed a lot of training data. So that's how we learned about tokenization, right? I never knew anything about it. I've been in the healthcare industry for a long time, but never knew that that was happening. And then we quickly learned that we could get those data sets and connect them through tokenization. And then in the conversation, just because I'm a personal kind of privacy advocate, I was very curious about understanding more about the types of data that we could get. And, we were freely told that we could buy other data sets, consumer type data sets, as I described, and could also connect that information. And I was just appalled at that point, and so was my team. And so I asked my team to go out and I said, go find somebody that's doing something about this. This seems ridiculous. And we couldn't find anyone doing anything about it. And that's when I said, we need to build this.
And this was when?
This was a few years ago. So this was maybe 2 or 3 years ago where we had the initial kind of revelation. And then we looked at the market and thought we would bring something forward. And we brought the concept forward, but we kind of let it sit on the shelf. And then recently, last year, we had some deep interest from consumers in this. And so we decided to really go for it and launch it. And that's what happened.
Fantastic. Yeah, and I actually just signed up for HealthConsent today, so I'm checking it out. It's super easy to use. User interface is awesome. So congrats on that. Can you walk us through how like HealthConsent actually works? Like when a user signs up and what happens on the back end to protect that data?
Well, so a user can sign up easily just by first providing their email, then they're sent through, a checkout flow. Right now, we, allow kind of a free trial for, I think about a week, just so they get the feel of it and make sure it's for them. And then once they start the onboarding process, we verify their identity for obvious reasons, right? Because we're going to be acting on their behalf. We want to be sure we're doing it for a real person. So we have IDV. And then once a user has been verified, they're in the dashboard and they have the ability to choose from providers, which would be your doctors and hospitals, clinics, et cetera, pharmacies, data brokers, PBMs, labs, et cetera. And we have over 7 million providers in the system that can be.
Yeah. I mean, I said for mine, it popped up straight away. So yeah, it's really comprehensive. I mean, I live in San Diego, so I assume you started on the West Coast, but 7 million, that's a lot of work.
It's a lot. It's a lot. And so once they pick, their provider or their entities, we have systems that go out and do research, or we have existing research that we pull from, where we kind of know what an entity's process is for a person to exercise their privacy rights. And so we tweak whatever our outreach is based on that specific context, and we essentially follow that privacy request from the request to conclusion, and then we report back to the user. And so it's an easy to use interface, right? You're really just signing up and saying, I want to exercise my rights. Everything, all of the heavy lifting is happening on the back end by our systems and by our people.
So from our audience's point, why should they be paying attention to this shift towards patient-centric privacy?
Well, I think, privacy expectations are rising, right? I think with people, we saw a study, 78% of patients expect comprehensive control over their health data across all their health data points. And that's really not happening, right? I don't know when the last time you went to the doctor was, but you're still getting these paper forms that you fill out and sign, and
20 pages. Yeah,
sure. And then it's just a blanket authorization for your data to go anywhere they want it to. There's also kind of regulatory complexity. I think you're starting to see states step up, states like California and Colorado, Washington, and pass more kind of consumer-friendly laws with regards to data privacy. Now, health data does have some carve-outs in there for HIPAA reasons. And so we need to go further from the health data perspective, but we're moving in that direction. And so organizations need to be mindful of that and get ahead of it. And then I think there's just a member retention impact, right? You're seeing, I think now we're seeing over 700 breaches a year occur in our industry. And that doesn't give a lot of confidence to the patient when you get one of those letters that says your data was stolen. And it's not just mom and pop provider shops. These are major healthcare organizations, in some cases the biggest in the last few years. And so they're losing hundreds of millions of records at once. So what was the point, right? What was the point of all of these protections if they can't really protect our data? So we try to reduce the surface area, right, the attack surface area, by exercising deletion or suppression requests, or reducing or limiting or eliminating sharing. And then, when you reduce the attack surface area, then there's less of a chance that your data is going to get out there, even if it is breached. So we're trying to address this directly. And patients want it. They want to stop their data from being sold. I bet if you ask patients, can we take your data and sell it? The answer is going to be no, probably 100% of the time. So we need to change the way we think as an industry, and we need to lead with privacy.
No, 100%. I want to kind of, I think the term's steelman this a little bit. So, there's America. So there's always, for every one side of the story, there's another side of the story. And
Sure.
So the one side of the story is that we need to make sure that our rights are protected and our data is not shared and sold without our consent. The other side of it is, I guess there's a balance between privacy and then patient outcomes. I don't want to necessarily hear too many times that my healthcare provider hasn't been able to get access from another provider that I work with because of extra stringent privacy framework. So I guess there's a balance. Would you agree with that first? And then if so, how do you strike the correct balance, especially with my?
Well, it's a good question. So I think, I'm a technology guy ultimately, and I believe that most problems can be solved with technology, and certainly understanding where your data goes, and who you have permission to give it to, and for how long, and what portions of that data someone can see, is very easy to do from a technical perspective, right? And to provide a patient with that forward-facing capability should be inherent and part of the healthcare engagement process, but it's not. We just talked about it, right? You sign a blanket form, that you don't really kind of read or understand because you have a cold or something else going on and you want to see the doctor, and from there, it's gone forever, right? And the data is being freely exchanged. But we could change that if we wanted to. So I think it's really incumbent on patients to get educated and understand what's actually happening, and then to exercise those rights. But there are patients that don't want that data shared, right? And ultimately, that should be the default position. And this whole idea of interoperability and the importance of it, you rarely see an emergency situation where some hospital somewhere else needs to access data from your home area. In any case, if they needed to legally, they can. So they don't even need authorization. It's written into the law. But now, that data is free flowing. And I think we need to have some sort of controls over it from an ethical standpoint, at least. And in any case, if you look at kind of data being used by, let's say, research, right, that maybe you would be okay. I think maybe a lot of patients would be okay with their data being used for research or to help other patients or for drug development, maybe.
Yeah.
But with AI and synthetic data generation capabilities, you can generate any data set for any cohort you want, and it will match a real world data set now. There's actually no need to have real people's personal medical information anymore. We can just generate the synthetic data, and there would be no privacy issue.
Yeah, that makes sense. I'm fascinated to hear from the audience about this. Where do you think if there's a scales, where do you think the balance lies? I mean, from what you say, and I think the balance is well and truly right now in the camp of the data brokers and the ability for them to legally sell that information. But let us know in the comments what you think. So finally, looking forward to the long-term vision for HealthConsent. What do you have in the pipeline? What do you hope to change with the standard and for healthcare privacy in the coming years?
Well, there's two things I think, besides evolving the consumer side, in which we're going to be adding a comprehensive set of HIE, so health information exchanges, pretty soon, and some other categories, PBMs. So we will continue to evolve the consumer side and allow them users to choose from more entities. But the business side is really one of our focuses of our upcoming launches, and certainly providing healthcare organizations with comprehensive privacy platforms that allow them to essentially do what I described, which is give patients the power to decide where and when their healthcare data is shared, when it expires, et cetera, and have an enterprise level kind of capability and auditable capability for that information. So that's one of our focuses. Another focus is really on organizations that have suffered a data breach, and how do they kind of save face and help their brand in a very bad situation with their consumers. And one way is not to just offer credit monitoring for a year or two, like they do every single time. It's really to offer an alternative like HealthConsent to their members, so that they show we're serious about healthcare privacy now.
That's a great idea. Yeah. Okay. Well, that's very exciting. Looking forward to keeping track of where things go with HealthConsent. And as I said, we met yesterday. If there's any way that we can help here, just let us know. And yeah, well, thank you for joining the show. It's Dr. Edward Sharpless, everybody.
You're very welcome. Thank you so much. Appreciate your time.
All right. So that wraps up this week's episode of the HIPAA Insider. Remember, compliance isn't just about checking boxes, it's about building trust.